Now it's time for tip-episodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
How are you today?
Doing well. How about yourself?
I'm doing great, thank you. And I'm so excited to have you on this episode for A Tale of Two Hygienists. Just to give people some background, I'm Tanya Dunlap from Perio Protect, and I'm here with Dr. Gordon Frasier, a periodontist who's been using Perio Protect for more than 10 years. Doctor, tell us a little bit about your educational background and early years.
Well, I am originally from Los Angeles, California, by way of Guyana, South America. That's a story in itself, so we're going to cut straight to the chase. I did my undergraduate dental training at Temple University in Philadelphia. Once I finished that, I applied for a scholarship with the United States Air Force. I then trained in Perio with the Air Force and Temple. They sent my family and I to Japan, where I essentially began my Perio career.
All right, that had to be exciting.
Oh, I didn't know how good I had it. That's the only problem.
Well, I got to know you around 2013 or so because you were the lead author on a Catapult review of Perio Protect products. And in that review, which was published in 2014, you had a patient who was a surgical case that was an example for the reviewers. And that patient you did LANAP surgery on, and then we showed the results from that, which were good. And then the patient used perio tray therapy with perio gel for 6 weeks, twice a day, and then dropping down to one time a day. And the gums just looked gorgeous. The teeth were whiter. All of the positive benefits that you and I know from Perio Protect. Back when you were first starting, do you remember what you thought about Perio Protect, and if it turned your head once you saw those results?
Well, in my Perio program at Temple, my instructor, or the chairman, I should say, was very big on the Kai's technique.
Oh, yeah.
And the idea that oxygen and anaerobes don't mix. And so when I saw the protocols for Perio Protect, I immediately was drawn to it because it related exactly to the kind of training that I received.
All right. And that is a unique feature that most people don't understand. Most people think Perio Protect is designed to kill bacteria, and you do kill bacteria with every application, but it's only the surface layer. The extra benefit of the hydrogen peroxide use, and the really important benefit, is the release of the oxygen, because that creates a toxic environment for the anaerobe. So it fits exactly in that philosophy.
Exactly. So one of the ways I explain that to my patient is, imagine the world with no oxygen. All the animals would die. So if we take that in reverse and introduce oxygen to an anaerobic world, which is an environment where lack of oxygen thrives, we actually do the opposite. And when I make that explanation, you start to see light bulbs start to go off in understanding how we can control the disease, not eradicate it, but control the disease. Somewhat like how folks with diabetes can never get rid of it for the most part, but can control it.
That's right. And you do that. It's kind of a radical concept, but it's by ecological management. You change the environment by the addition of the oxygen, and then you can change the kind of bacteria that repopulate, and you get really healthy bacterial species, and then you have healthy tissue.
Exactly.
As a periodontist, you tend to see the very advanced cases. Tell me a little bit about your philosophy of trying to, salvage teeth that you can, and getting that foundation of gingival health set for patients.
So every patient that comes in gets an overview of what periodontal disease actually is. Because my philosophy is that if you don't understand it, you're not really going to care about controlling it. So I explain that it's somewhat similar to catching a cold, in that we get bacteria in the nasal cavity, the body's immune system reacts to it, the nose gets stuffy and inflamed, like the gums, the body creates mucus, the mucus encapsulates that bacteria, you blow it out, cold goes away, no big deal. Now, If the body doesn't do a good job and the cold lingers and lingers, you go see a physician that gives you an antibiotic, kills the bacteria, cold goes away. Well, in the mouth, the bacteria colonizes outside the body, yet inside the mouth. The bacteria is alive and it secretes toxins into the tissues, which cause that same immune system to elicit a response, i.e. your gums getting stuffy and inflamed like the nose. Well, the body can't get outside of itself to get to that bacteria. So what happens? The body turns on itself and starts destroying around the bone, around the teeth, in the hopes that the teeth will fall out and the body achieves its protective mechanisms by getting the bacteria out. But by using periodontal protocols and getting rid of the bacteria and stabilizing with Perio Protect, we can prevent tooth loss. And in many cases, get a gain of attachment in order to stabilize the situation.
So you are a big proponent. You talked about your periodontal protocols. You are a big proponent of laser therapy with Perio Protect. What kind of results do you see here with your protocols?
Using Dunlap and Perio Protect has probably been my largest referral mechanism, because my referring doctors are seeing not only initial results, but sustaining results. And because we're getting these sustaining results, I'm getting more referrals. So in other words, Perio Protect does exactly what it says it's going to do. The key point, like in everything else, is making sure that your patient is motivated to stay consistent to yield these results.
Yeah. And so let's talk about that, because with any dental appliance or product, consistency matters, and dental professionals are concerned about this. I know you have your own personal story with Perio Protect, but you've got hundreds of patients in perio tray therapy. How do you motivate them to stay consistent, and how do you stay consistent?
Well, I do many different things, but the one that I think hits the mark the most is when I'm explaining exactly how to wear the trays. So I tell the patient that they're going to need to initially wear the trays 3 times a day for 15 minutes a day. And in that explanation, I talk about how the multiple times kills the bacteria, but if we allow the bacteria to build up too many layers, we can't penetrate and be as effective. So as I'm explaining that, I pause and I say, there's a side effect. And they're waiting for that answer. And I simply say, it whitens your teeth. And I get a big smile. Oh, yes, I want whiter teeth. I'm going to wear these trays. Now, I don't know why they wouldn't wear the trays to help their gums. But whenever I say whiten their teeth, they get excited and listen for clients when I tell them about that side effect.
And it is important to let listeners who aren't familiar with Perio Protect know that 3 times a day is just for a kind of an acute initial phase. Our goal is to get them down to 1 time a day, just 10 to 15 minutes as quickly as possible. And you've been wearing Perio Protect this way in this maintenance phase for a long time. And I've been wearing Perio Protect for 20 years now. I do love the whitening effect, but I also use my trays to preserve my crowns. I have 2 crowns in my mouth, and I want those to last as long as possible. What do you see with your patients who have restorations, and what do you know from your own personal experience?
Well, I have a personal testimony, if you will. So in full disclosure, I would tell patients to try to implement flossing in their daily shower. Because if they forget to floss after a certain amount of time, it would kind of feel like they forgot to wash their underarms or something. So if this was something that I did myself and I found myself being more consistent with my flossing, well, as human nature does, I kind of laid off it for a while and said, my gums are fine. I'll floss when I need to. And one day I'm flossing and I'm seeing bleed, and it's like, holy moly, I've got a problem. So I quickly implemented my tray therapy with my regular flossing, and within 3 weeks, there was no bleeding. And it changed my perspective as to what I'm telling patients and the passion with which I tell patients, because I've experienced it myself. When you experience something yourself, there's just something inside of you that changes because you truly know that it works.
Right. And talk a bit about what your mouth feels like, because I talk about a Perio Protect clean, but you don't know what that is unless you use the trays.
So if for my smokers out there,
Oh yeah.
oh, your mouth has this kind of sour residual taste, maybe even kind of a dull soreness all around the mouth. But after using the trays, all of that's relieved. The surface of your teeth feel like you just got a clean. I mean, it's a wonderful feeling to feel like, oh, well, I have fresh breath. My mouth feels almost as if it were sterilized.
Yeah, I can't stop my tongue from running over my teeth sometimes because they're just so smooth and clean. And what I've noticed is that I don't even wake up with morning breath anymore. Does that resonate with you?
Absolutely. Absolutely.
Okay, the last thing I want to talk about here, unless you have anything else you want to add, is implants. You do a lot of overdentures. I know we've talked about how you use gel with removable, but let's also talk about single implants. This is a problem in the profession to maintain the health around implants for a patient's life. What would you tell general dentists and periodontists about Perio Protect for patients who have implants?
Well, I'll start with the overdenture because I've seen miraculous results with that. Now, let's face it, folks that are wearing overdentures are predominantly folks that didn't take care of their teeth, which is why they're in overdentures. So they're not really prone to taking care of their implants. But what we've asked all of our overdenture wearers to do is to basically place some of the perio gel inside of their overdenture, specifically where the implant links into the overdenture. And what we've seen over time is healthy, tight, attached tissue, which then protects the rest of the implant.
So these would be for removable overdentures, and they're placing the gel in there on almost a daily basis, right?
Yes.
Okay.
Daily basis as part of the protocol in terms of keeping the prosthetic clean, and keeping the gums and the implant interface healthy.
Yeah.
For single tooth individuals, I find that it's a very same situation in that the tissue is not boggy. It doesn't pull away from the single tooth implant, especially in the anteriors. In the anterior, based on the implant placement and the tissue type, is very prone to recession. But in using the Perio Protect, it almost allows the tissue to fortify itself, stay healthy and attached.
Yeah, we see this in those before and after images, and it's really exciting, and it can be very dramatic.
Yes, if you have recession around the implant in the anterior quadrant, you're not going to be too happy. And number two, that's a very difficult area to graft and fix and have it look real in life, and not like patchwork.
Yeah. Okay, last question for you, please. And again, I thank you so much. This has been fun to have time with you. If you were going to be talking to either one of your referring dentists or another specialist who's not yet familiar with Perio Protect, can you describe a little bit about implementation process? I know it's been a long time since you've implemented, but what would you tell them about how easy or hard it is to get started, and what's the payoff in general?
First thing is to make sure you're educating your patient about periodontal disease. If patients are educated and given enough information, they're going to make the best choice for themselves. Now, granted, sometimes that choice may not be to do what you'd like them to do, but the one thing you know is that you gave them the information and opportunity to do that. And in most cases, if they don't make the choice now, they will make it later. Information and education has been the key to our success. Now, when we bring in a patient, we explain the periodontal disease process, very similar to how I did earlier. We showed them an animated video so that they can visualize what's going on. My assistant talks about the same thing. I talk about the same thing. My front desk talks about the same thing. So by the time they're ready to close out, they've heard it 4 to 5 times. And when you hear something 4 to 5 times, if you're going to move forward, you will, i.e. advertising. If you see an advertisement 4 or 5 times, which is why folks advertise over and over and over, if you even have an inkling of partaking, that 4th and 5th time usually closes the deal, because something in the human psyche tells you it's real and it's something you should do. If you're not going to do it, you're just not going to do it. And a lot of times people don't do it, not because they don't want the health benefit, but sometimes the time is not right. They don't have the money. They know they're in a situation somewhere else or some other aspect of their life. And we personally don't want to add more stress to our patients' lives. So we don't push. We strongly believe that when the time is right and they're looking for someone to help them treat their gums, they're going to choose us, because we gave them more information than anyone, more education than anyone, and more importantly, we did not press them to do something they were not ready to do at that time.
I'm really glad you brought this up, because I just think it is so important that patients understand they have an infection. They can't make any decisions if they don't understand the state of their oral health, right? This is the very basic part.
And who doesn't get rid of an infection? You have diabetes, you want to know how to control it.
And I know you've used Perio Protect for those patients. You've referred them or you've recommended surgery and they've declined. Mm-hmm. They want to exhaust all of their non-surgical options first. That's another way that you have employed Perio Protect, correct?
Yes. And those patients I tell right from the get-go. This is like going from, can you remember a show called The Swan, where they do this makeover? Or even those shows where they show you someone who's 300 pounds overweight, but they've got to change their whole lifestyle in order to lose the weight and maintain it.
That's right.
Well, and those folks that are in that situation where they're either looking at making a lifestyle change and doing things differently, or setting up to do a full mouth rehab, I tell them that that's where we are. And if you're not willing to be 100% committed and motivated, you're wasting your time, because consistency is key. But if you will be consistent and do what you need to do, I promise you the results will be miraculous. And I don't like to make promises, because you know how people are. You promise something, they multiply exponentially and said, oh, you said I was going to have golden wings too when I can't fly. Here, I've been very, very happy, and it's been a real practice builder for us. And as a periodontist, as you know, sometimes we play the role of a dumping ground for a lot of folks that just don't know what to do with these patients.
That's right. You end up with the most severe cases.
Yes.
Yeah. Well, it has been our privilege to work with you, and I thank you for your time sharing your expertise today.
It's been a real pleasure. I look forward to seeing you in the near future.
Thanks so much.
Bye-bye.
Have a great day. Bye-bye.
A tale of two hygienists.